Assalamu alaikum. Today I'd like to tell you about a workshop which is called Many Digestive Surgery Skills that I attended in the National Congress of Medical Students and Youth in Bucharest, Romania. And it was really helpful, and I'd like to tell you about what I learned. So basically the workshop was about the suture-based anastomosis for intestines, specifically small intestines. And the tools that we used were, of course, the suture string, and the needle, and the needle holder, also the forceps, in different kinds of forceps. So the intestines looked something like this, and we needed to cut a part in the middle in order to anastomose between this part and this part. And in order to do that, you put the forceps on that side, let's say. So it will look something like this. So this end will be behind the intestines, and this end will be above the intestines. So like this. And with the blade or the scalpel, you begin cutting from upwards to downwards in a linear motion, like this, in a linear motion, in order not to miss the contents of the intestinal lumen. And this will be the same case, so it will be like a mirror shape, and we'll begin cutting from this direction, like this. We will get something that looks like this. So this is the serosa, or the external layer of the intestines, and this is the mucosa, or the internal layer of the intestines. And the sutures will be on 3 steps or 3 stages. First, there will be lateral or superficial, and these will connect between the serosas of the 2 intestines. And there will be an inferior one that connects between the mucosas, and then a final continuous suture that actually end the anastomosis. And so for this, it will be very lateral. It goes from the outside, then inside, like from here, and goes all the way from inside to outside, and then from outside to inside, from inside to outside, and so on. And it goes all the way like this. For the interior is the same, or maybe you can form single knots. So instead of going continuously, you can do that, and then can hold that with the hemostat for the hemostasis. There's a forceps so that it keeps the tension on the string. And when you finalize the exterior and the interior sutures, then you can take for this side and you want to complete on the other side. So this is the posterior side. You begin with the posterior because it's much harder. And then to the interior side, you take the long edge off the string and then you complete the suture. And when you finalize it, you tie the knot with the lower or the shorter side of the suture. So basically that's what we did, and the most important thing that we need to know is that the shape of the intestines after you finish should look something like this. It should look something like this, and it should be concave, not convex. It should be concave because this is very important in order to keep the contents of the lumen inside the lumen, because this is the intestines and maybe there's hydrochloric acid or other secretions, and we don't want this to get outside. So this should be concave and not convex. And this is in brief what we did in this workshop. I hope it was clear for you, and until the next time, thank you for watching and see you.